This is Health Tracks, and I'm Peter Graber. Our topic today is the recently rolled back Medicaid Provider Rate cut. Over the past couple of weeks, the North Carolina Academy, along with several other leading North Carolina healthcare organizations, have been working very hard to prevent a 1.35% Medicaid provider cut. The cut was one of several contingency money-saving measures approved by the North Carolina General Assembly as they grappled with a tough economy late this summer. Here with me today to comment on this issue is NCAFP Executive Vice President Greg Griggs. Greg?
Thanks, Peter. This has been a very tough issue, and we just want to thank Governor Beverly Perdue for making this decision not to implement this rate cut September 1st. We are very fortunate that North Carolina has a strong tradition of providing medical homes for our state's most needy citizens through a very strong infrastructure in Medicaid through Community Care of North Carolina. We know that times are tough with the economy, and we know that everyone has to tighten their belt, but slowly but surely we've chipped away with that infrastructure on Medicaid, and we've got to make sure we maintain that. Over the next several years, it's expected more than 500,000 new North Carolina residents will be enrolled in Medicaid as part of national health care reform. So we're very pleased that the governor did not implement this cut. As a matter of fact, we're getting ready to send her a thank you note for her efforts on this important issue to make sure that we have adequate medical homes for all of our state citizens.
Excellent, Greg. And so these rate cuts are going to go into effect, when, January 1st?
Well, we're not sure. They could go into effect January 1st, but we're hopeful that as we get into the new legislative session next year, there can be a more permanent legislative fix. They've at least been pushed back for a period of time now, and we're hoping with some of the extra federal stimulus money that has come into North Carolina that the rate cuts will be permanently removed from the table to protect this infrastructure for Medicaid in our state.
Excellent. Well, thank you very much for that summary. And that is the current state of affairs regarding the cut. And as further developments continue on this, we'll have more information for you down the road. Once again, Peter Graber with NC Health Tracks.